Example, they have essentially no autism. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol during pregnancy, can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless
relationship between acetaminophen and autism.
Something that has been studied for close to decades at this point. A lot of this information and this cause, it comes from a recent study that reviews older studies on a connection between the use of Tylenol or acetaminophen in pregnancy and the outcome of autism. Now, important to note that even the authors of that study that is referenced have gone on to state that that study does not prove what we call a causal link. It does not prove that Tylenol causes acetaminophen. Important to remember, two things can exist in time, does not necessarily mean that one causes another.
So do I hear you saying it's a new review of old data?
It's a new review of old data, and important to note that there are many reasons why a pregnant woman might use Tylenol in pregnancy, and some of those reasons might be connected to neurodevelopment of a child. For example, fevers during pregnancy, so important to manage. An uncontrolled fever increases risk, stress from pain. All of these reasons are reasons why it might not necessarily be a cause and effect, instead an association.
Educate us about leucovorin, a cancer drug, as a potential autism treatment, because that's going to be talked about as well.
It will be talked about. Another